Deceased or posthumous organ donation is one of the most sensitive yet vital topics in modern medicine. It refers to the situation when a person agrees while still alive that their organs can be used to save others after their death. In many countries, including Turkey, systems have been established where the culture of donation is supported at both the governmental and societal levels. Today, experts whose work exemplifies how an effective, ethical and humane transplantation system can be built have arrived in Astana on an official visit. And with us in the studio is Dr. Eyup Kahveci, a renowned doctor and the head of one of the most active non-profit transplantation foundations in Turkey. Welcome, Dr. Kahveci. Thank you very much for agreeing to participate.
Thank you for your time.
Thank you. The first question for you, can we say that the culture of deceased organ donation in Turkey has developed and it has become a part of public consciousness?
Yeah. As you may know, the transplantation is a life-saving therapies for patients who has chronic organ failure. Such as kidney failure and liver failure and heart failure and lung failure. So if a patient has a live donor for liver transplantation and kidney transplantation, after pre-transplant workup and they are switchable, they go to the transplantation. If a patient has no donor from family and friends, these patients will only wait from deceased donors' organs. So deceased donor organs is a common shortage problem in worldwide. So in Turkey, we are trying to increase the number of the deceased organ donors. So the deceased organ donors is a multidisciplinary and multisectoral and multicultural problem in our country as well as in the world. So to increase the deceased donation in Turkey, we carry out many field projects such as training for healthcare professionals in hospitals, in healthcare facilities. On the other side, we are trying to increase awareness of public. So public awareness is a very important issue in deceased organ donation. So it's affected many components of the societal attitudes such as culture, economics, ethics, legal and religious problems directly affected the organ donation from deceased donors. So to handle this problem, to raise awareness of organ donation, we are organize many activities for community leaders, for religious men, and for media representatives and youth people, and there are many different field projects to raise awareness of organ donation and transplantation in Turkey.
Yeah, thank you. So let me be clear. Despite efforts, only, as far as I know, only 20% of kidney transplants in Turkey came from posthumous donors, from deceased people, right? While in developed countries, other countries, the figure reaches up to 80%.
Yeah.
How are you working to improve this situation? Maybe some steps to reach the level of developed countries?
The high number of the living donor kidney and liver transplantation in Turkey is a mandatory situation for Turkey. So we have a very strict organ shortage problem. We are trying to increase the organs from deceased donors, and currently we have high number of living donors, and Turkey located at the top level of the top level of the living donor for PMP per million people in the world.
If I'm not mistaken, it's top 3. Turkey is one of the top 3 countries, right?
Yeah, exactly. So to increase these numbers, 20% of deceased donors. So there are many public campaign and training programs in Turkey. We organize, we carry out. I think step by step we will increase the number of the deceased donors this year and next year, I hope. When compare the number of deceased donors last year and this year, in the first quarter of this year, we have up to 20% increases we have.
Already.
In deceased donation.
Thank you. So let's talk about this. In Kazakhstan, in Turkey, as well as in Kazakhstan, right, organs cannot be used without the consent of their relatives, even though the person had given his own consent while alive to make their donor, make their organs to be donored, right? So is there any plan to change this legislation? Maybe in Turkey already any initiatives have been?
In general, worldwide, there are 2 consent systems, informed consent and presumed consent. In Turkey and in Kazakhstan, we have informed consent system in organ donation. So many countries in Europe switch their system, the legal system, from opt-in, from informed consent to presumed consent, to opt-out system, to get more organ donor from deceased donors. So in Turkey, we started last year. We have started to discuss about legislative transformation, the consent system in organ donation. I hope this year and next year, maybe we will take another stage of the parliamentary level to discuss the legislative transformation about the consent system. I don't know exactly current situation in Kazakhstan. Is there any discussion to switch the consent system from informed consent to presumed consent? Yeah, that is important to increase the number of deceased donors and to increase the number of volunteers of the organ donation.
So now let's talk about the religion sphere of this topic, right? In Kazakhstan, religious leaders, they officially support deceased organ donation. What about Turkey, right? How do you engage with religious leaders, public people, public figures, and the whole society to increase awareness in transplantation and their support?
Actually, in sophisticated medical area, the religious point of view is important for the people's decision, such as organ donation. So in Turkey, the higher competent authority of religious affairs decided to support organ donation and transplantation in 1980. And currently, the competent authority of religious authority supports organ donation and transplantation strongly. But it is not enough to motivate the people. So there are many sub-components, groups of religious groups in Turkey that are problematic. Their leaders sometimes give opinion regarding the organ donation and transplantation negative effect of this concept, organ donation concept. The people affected this announcement of the subgroup leaders, religious leaders, but the competent authority of the religious affairs strongly supports organ donation and transplantation in Turkey.
I'm happy to hear that.
Yeah.
I would like to talk about your foundation. It is known that the foundation is strongly supports, encourages, and its focus is on education, right?
Yeah.
What's the core principles behind the work?
So the Turkish Transplant Foundation established before 30 years ago, working in organ donation and transplantation in Turkey and international area. So in Turkey, we carry out many training programs for transplant professionals and donation professionals. And we carry out many public awareness campaigns in different cities with our stakeholders, such as universities and volunteers organizations and non-governmental organizations, sometimes official organizations. And international area, we carry out many capacity building programs in different countries at the level of ministries of health to establish a organ transplant program in the countries for people's access to the transplant services, or strengthen the current existing transplant program in the countries, many countries. So this international cooperation is very important for exchange of knowledge and sharing experiences between countries as a health diplomacy activity and public diplomacy activity. So in terms of this cooperation, we have already a memorandum of understanding Kazakhstan Regional Republican Transplant Coordination Center to strengthen our collaboration on organ donation and transplantation, and sharing our experiences with Kazakhstan healthcare professionals and healthcare system to improve the organ donation and transplantation services for the Kazakhstan patients. Yeah.
Thank you. The things that you already said about the Kazakhstan and Turkey cooperating in this sphere, is it a part of the coordination platform for transplantation among Turkey countries, or is it different?
Yeah, last year the fourth meeting of health ministers of the Organization of Turkish State, there is a decision regarding to establish a Turk transplant network, to establish a close cooperation among member countries to strengthen the organ donation and transplantation system based on the experience and knowledge sharing. I hope tomorrow, at the tomorrow meeting, the 5th meeting of the health ministers, the Turk transplant projects will move on and concrete step. And after establishing a Turk transplant network, the member countries will have very highly beneficial from each other's experiences in the field of organ donation and transplantation.
How do you view the cooperation? Is it about sharing experiences of every country, or is it about maybe sending doctors, right, nurses to other countries, and they're doing the surgery, transplantation?
All of them.
All of them?
All of them, yeah. Sharing experiences and knowledge exchange and trainings and the organ exchange and information exchange including many subcomponents.
Okay, thank you. And the last question, just shortly, yeah? How do you think, what are the most important steps to promote a culture of deceased organ transplantation system? Like maybe the topic is sensitive somewhere, right? In many countries, the topic is very sensitive. So what countries or what people, what organizations need to do to make it less sensitive, to promote it everywhere?
Yeah, it should be considered that organ donation is a strong solidarity among people, including many stakeholders, religious leaders, community leaders, and politicians, policymakers, and volunteers organizations, and media institutions. All of them should be included in the process to increase the awareness of the organ donation and to save more lives who are waiting on the waiting list.
Exactly. So shortly, it's a common work of everyone to participate in promoting organ donation because it can save people's life.
Yeah, correct.
Thank you very much for being here and giving your time for us to answer the questions.
Thank you very much. Thank you very much.
Our guest was Dr. Eyup Kahveci, a renowned doctor and the head of one of the most active non-profit transplantation foundations in Turkey. That's all for now. Thank you and see you next time.